Welcome back to the Whole Career Podcast. I'm your host, Brandon Strawn, and I'm also here with my co host, Sky Kellogg. We're extremely excited today because we have Monty Jacobs, the Director of Global Missions, with us. How are you doing, Monty? How are you?
I'm doing great. Great to be here with both of you today.
Awesome, awesome. We're honored to have you. So we'll jump right in, if that's okay. Can you share a little bit about your role as a global missions director, just so we can have an understanding before we get into, the 13 years of work that you've accomplished here?
Sure. As you said, I've been here 13 years. We set up the Global Missions Department about 15 years ago here at Advent Health, and I have the privilege of leading a great team of people. We lead mission trips, so we organize donations of medical equipment and supplies. We do all kinds of fun things impacting the world.
Awesome. Awesome. And really quickly, just going into detail about how you got involved because you mentioned 15 years ago. So you got here when it was fairly new. So what was that like just coming in right when it was really fresh and how you were able to really get involved?
Yeah, so I was able to join Advent Health, back then Florida Hospital, when Global Missions was in its infancy. And it was really based upon a desire to bring together in a more consistent fashion the work that we do globally. So prior to that time, it might be a campus that was doing something internationally or a leader that might have been doing something internationally, but there wasn't a consistent focus. It was always something added to someone's plate or an extra project. By bringing together a department, giving it some resources, giving it an office location, it allowed us to be involved more consistently over time to be involved in this global work.
Wonderful. And how does Advent Health having a global missions department set itself apart from other healthcare organizations?
I am not aware of another healthcare organization of our size that does as much globally as we do. So we're currently involved in 17 different countries around the world, providing support to selected institutions that we get to work with over there.
Mhm.
Um, in addition to creating volunteer opportunities, primary care mission trips, surgical care mission trips, construction projects, donation of medical equipment and supplies that allow us to really raise the quality of healthcare that's being provided. I'm unaware, as I said, of any other organization of our scale, of our size, that does this type of work at this volume.
Mhm.
Yeah, that's amazing. And taking it back just a little bit, when you started 13 years ago, what was the size of your team then and what is the size of your team now?
So there was two other people that worked with me when I started, my assistant and a project manager. Now there's eight of us. We have three people working in our warehouse activities, doing warehouse activities. We've got a nurse education consultant. We've got another director of operations, employee engagement, communications, finance. So we've really grown over the years. When I started, we had 5 countries we were working in. Now there's 17.
Wow.
I kind of just want to jump into the fact how do you get involved in 17
Right.
countries? How do you even find contacts in that many countries?
Um, there's a saying, "How do you eat an elephant?" And the response is one bite at a time. In some ways, sort of the same thing,
Yeah.
right? You build relationships over time. You interact with people. I like to say you don't have to get married on your first date. And so, just because a country or an institution says, "Hey, we want to work with you," doesn't mean that we say, "Okay, sure." We take some time to develop that relationship. We invite them to visit us. We go visit them. We might work on some projects together. So all of those things come into play.
And has there been a time you've said no?
Absolutely. Or slow down. We're always very gentle about this
Right,
process,
right,
right?
right, right.
And so sometimes it's just not a good fit.
Yeah. Yeah. Okay. So how does Advent Health's mission of extending the healing ministry of Jesus Christ, how does that guide the work of the global missions team?
So, we are a faith-based organization. And so extending means to go out. So oftentimes we view that as being in our own communities, but for our global missions team, we take that to the world. And so we look to partner with like-minded faith-based organizations. And so that's really key to the relationships that we build, the work that we do. We want it to be with organizations that believe like we do, that extending the healing ministry of Christ is core to our mission or core to our existence.
And what are some of the key initiatives and projects that Global Missions is currently working on? And how do you decide what projects to even focus on when there's so many countries and so many needs across the world?
Sure. So we actually have sort of five areas of focus for global missions. One is our footprint relationships, and we can talk about that in more detail. Second is we really want to build this culture of volunteerism and generosity among our own employees. And so this is something for us to really give us that culture that we want in our organization here.
Mhm.
Three, we get involved in international humanitarian events. And so if there's a hurricane or an earthquake, we sort of serve as the central hub within Advent Health to help coordinate responses in those types of situations. Then we want to promote whole person care. And finally, we serve as a contact point for the global Seventh Adventist Church, which is our heritage, to be able to connect with Advent Health as well.
Oh, that's awesome. I think it's so you guys have pretty much five. Are there five pillars or five key focuses?
Yeah, five key focuses.
Awesome. And so you mentioned building volunteers, right? How difficult can that be? It shouldn't be difficult, right? Because everyone here at Advent Health, and I'm going to look into the camera, should be more than willing to extend. But I know that having working with company that has such great workers, right? And they're already devoted to their full-time job or whatever they're doing. How do you do that, right? How do you get people to say, "Hey, I know that I have a job that I'm already doing with Advent Health, and in that role, I'm extending the healing ministry of Jesus Christ." But how do you then get them to volunteer for additional, events and initiatives?
So I think Advent Health does attract a certain type of person that wants to come to
Absolutely.
our organization that our mission resonates with. And so a lot of those people have a desire to serve. And so for us, our goal is to create opportunities to allow them to focus that desire. So we organized this year about 30 medical mission trips and other types of trips. So there's a lot of opportunities for people to be able to go. We expect about 500 employees, staff, team members to be able to participate in our global missions work in 2024. We're looking to grow that in 2025. So creating those opportunities really is sort of key to that, because we've seen that people respond,
Yeah.
and so it's not a function of us having to go out there and voluntold people to be able to come and join us on a mission trip.
Yeah, yeah, and that's good because I think for the recruiters out there, right? Let's keep on recruiting those servant leaders, people, right? Who are willing
Absolutely.
to serve because it definitely helps the global missions team. So that's
Yeah.
awesome.
And can you provide examples of how Advent Health's Global Missions efforts have made a tangible impact on communities around the world?
So this year, I expect that our team members going on volunteer trips will provide primary care services to about 25,000 people around the world. And so, right there is literally thousands of people that are impacted. Our surgical teams will do over 100 surgeries, probably closer to 200 to 300 surgeries this year. That's life changing for the individuals who are either unable to afford care or maybe on a waiting list for a government hospital that may be 6 months, a year out. And so they can, really receive the relief that they need much sooner from a high quality healthcare organization. So that comes into play. And then we also look to build the infrastructure. So in Ethiopia, for example, we work with a school and an outpatient clinic. We've built a science laboratory for them, a computer lab for them, multiple classroom buildings. We put in a water well for clean water. All of those are things that have a lasting impact on what we're doing. That's just Ethiopia as far as we're working right now on a CT scanner for Nepal. That region doesn't have a CT scanner currently, and so people that need imaging like that have to go additional miles into the capital city in order to receive that kind of care. So those types of infrastructure projects also make a significant difference in those communities that is ongoing long after we've left, come back here to the United States.
And how does the funding work for things like that? Do you mind if we jump into that a little bit? I'm interested to know and how that correlates again with our mission and who
Sure.
we
So
are.
much of what we do is around philanthropy.
Mhm.
And so we work closely with the Advent Health Foundation to raise money. We look to outside partners as well. The CT scanner that I just mentioned for Nepal, that's a collaboration between Advent Health, the money that we've raised, our President's Council, our CEOs get together and they donate money to projects. And then Rotary International is involved in that project. And so that, they raised about $200,000 for that project as well. So it's really bringing together like like-minded organizations that have a desire to serve and a desire to see healthcare improve around the world, and sharing with them the work that's being done, the partner organization that we have that's a trustworthy organization to partner with, to really make those things happen.
That's amazing. And I think that understanding how the request when it first comes in, I think that would be really great for our audience. So I just wanted to see if you could break down, this is a fresh project, right? I don't know if a request even comes in, or do you guys seek them out? Can you take us through what that looks like from start?
Sure. So when we identify this footprint relationship, it's really based upon finding a like-minded organization. So for us, that typically means a organization with a Seventh-day Adventist heritage, faith-based heritage, like we have. We also have an executive sponsor. So that's a senior Advent Health leader that serves as sort of that strategic visionary behind our project work. And so we develop a 5-year plan of how we want to work together, and hopefully we're doing a lot of listening. And so if we're doing the listening right, we're hearing what their priorities are, what their focus is on. Is it on, healthcare education? Is it on infrastructure? Is it on a service line that they've been wanting to have but don't have the finances to do? And so we then choose, hey, we can help you with these 3 items that are on this list, and this is how we can do this. And so, going back to imaging, for example, anything that's complex with technology just requires so much work in developing countries. And so you think, oh, you just need to raise money for a CT scanner. No, you have to also make sure that the electrical systems in place at that hospital can handle a CT scanner. And so is that now having to work with the government and the public utilities in order to make sure that the electricity that's there, the transformers that are there, everything that goes along with it, it's just much more complex in these locations. And so I would say the other thing that comes into play with this is a willingness to be involved over time. And so it's not, hey, we're going to work with you for 6 months and then, hey, good luck. We're intending to be there long term, build lasting relationships. And so we're going to be involved for a minimum of 5 years. Well, I've been working on projects that are 3 years in duration. And so if you were just there for 6 months, you wouldn't have, the project would not get completed. Um, the goals would not be achieved. And so being involved long term really helps allow for um, projects to get completed that otherwise just you wouldn't be able to get done.
And you mentioned footprints, and I know you said we can go into a little bit deeper. Do you mind explaining to our audience what a footprints partner is for Advent Health?
So these are the organizations, those 17 countries that we're involved in, where we've said, hey, we want to be involved with you over this long period of time. And so it's an institution, like I said, that's got a faith-based heritage that shares a common mission with us. Immediately when you have those types of organizations, you've established a level of trust that you don't have to build over time, because you know where they're coming from. You know that you share those same, that same vision and values. Oftentimes, they're very focused on whole person care as well. Um, those relationships are really key to being able to accomplish the rest of our goals, right?
Yeah, and because then they're already set up in that country and probably already doing very similar work, and you probably need a lot more hands than what you can send from from here. And travel wise, how much do you travel to these 17 countries? What does that look like?
So I haven't been to all of them because some of these countries are supported out of different parts, different regions of Advent Health. And so our Colorado Rocky Mountain region is involved in several countries, Mid America region's involved, Southwest region, different parts. My office primarily supports the organization based here in the entire state of Florida. We do coordinate a lot of work with everybody else, but next week, I'll be heading over to Kenya to visit the hospitals there, exploring potentially a new relationship with a medical school in Rwanda. I was just in the Philippines last month, and the month before that was in the Dominican Republic. We had a gala anniversary celebration in Jamaica the month before that. So, on an average basis, I'm pretty much traveling at least once a month or so internationally,
Yeah, if I could borrow some of your miles, that'd be cool.
all on different airplanes,
Oh,
unfortunately.
wow. Okay. Okay. So I wanted to talk about just the cultural sensitivity of things, right? So how does the Global Missions Department prioritize cultural sensitivity and inclusivity in its work?
Sure. So I'm really blessed to have a very global team. So my team has people that have backgrounds from the Caribbean, Central America, South America, Africa. So, one, we want to very much create a very diverse team um, representing sort of the globe in the areas that we work. And so, right there, we get feedback, we get input from people that have different backgrounds. Second, we very much want to make sure that we are listening when we do our work. And so it's not, hey, we're here from Advent Health and we're here to tell you what to do. No, it's, hey, we're here from Advent Health. We're your friends. We want to hear what you want to do. And so that listening aspect is key because we don't have a desire to run a hospital overseas. We have a desire to come alongside, partner, help another organization that may be having challenging times in its environment economically. It's depressed. If the economics aren't good, then patients have a struggle to pay for healthcare. And so if your patients can't pay for healthcare, your organization's going to be struggling to provide that healthcare. So that really comes into play sort of from that diversity standpoint, and that cultural sensitivity is one, a lot of listening, and then two, having a team that really reflects the diversity of where we work.
And what advice do you have for listeners that are interested in getting involved in this type of work? How does one even begin to start entering the world of global missions?
So global missions work is not necessarily what everyone always thinks it is, right? Meaning it's really hard to do this on a full-time basis because there's just limited opportunities to be involved. But the first thing you have to do is just get your feet wet. We have a phrase, you got to get out of the boat and test the waters, so to speak. And so one, just getting involved in some fashion will help you identify the areas of interest that you have. So I would encourage everyone, hey, go on a short-term medical mission trip, see what that looks like, see how it resonates with you. Is this something that I might be willing to go live overseas and serve for a period of time? Obviously not as an Advent Health employee in that capacity, but if you're really focused on being involved in global health, you need to have that willingness to go and do. I would say that's probably the other component is really wanting to do stuff, not just talk about stuff.
Yeah.
And so, what we do is very action related. Organizing 30 mission trips a year is so that people can go do, not just so that people have a club to get together and talk about what they want to do.
I love that answer. And I know that you shared with us that your background is in law. For the listeners that may want to be wanting to get into global missions, if someone is in college right now, what do you think would be the best major for them to focus on if they're really interested and set on being a part of global missions?
So, global work really includes all occupations. So, if you want to be in healthcare, you can do nursing, medicine, and then get involved in global health. If you want to do finance work, there's financing involved, microfinancing, community development work. So I wouldn't say that there's really here's the career path to be involved in global health. It's more develop your expertise in an area that can benefit others and then have that willingness to, serve in different locations.
Awesome.
In what ways would you say that our participation in global missions work aligns with our commitment to supporting the whole person?
So, whole person care, mind, body, spirit, really involves multiple areas, right? And so, if you go on, say, a short term mission trip, it's going to be physically demanding, hot temperatures, working outdoors, different things of that nature. It's going to be mentally draining. If you're a provider and you're seeing 60, 70 people in a day, you're going to be mentally tired at the end of that time. And then you're going to experience spiritual growth as well during this trip because you're going to see people that you may think you had it tough here in the United States, but when you go abroad and you see people with a smile on their face, but you then hear their backstory and the pain and things that they're going through, it makes you realize, one, how blessed we are, and then two, being able to alleviate some of that pain for others can really be beneficial. And so for me, when I see people on a volunteer trip with us, they really have that opportunity to be involved in all aspects of whole person care, and so it's not just one aspect. And so that's part of what I love about what we get to do.
What is one of the stories from one of the countries that we're in, success story that you'd like to highlight and for our listeners?
You know, there's a lot of things that we do that we will never know the long-term impact. So, you build a school classroom, you don't know the children that are being educated there. You hear the stories that they're top passers on their exams, things of that nature. But it seems like on almost every mission trip that we do, there's something that comes to the table. And so, a couple of years ago, actually a few years ago, we were over in Ethiopia with a medical team, and a mom was carrying her child down the hill towards the clinic where we were operating. And one of our nurses immediately saw this and realized that something was wrong. And so he went running up there, grabbed the child who was, comatose, and brought it down. On that trip, we had a pediatric intensivist who did pediatric emergency medicine. So we had the exact right person to deal with that case right then. The team all gathered around. It was dark. It was reaching, later in the evening. We'd still been working late because the lines were long. People had headlamps on, getting lights on so that the doc could see what was going on, able to revive the child, ensure that everything was okay. It's times like that that you're like, for such a time as this, we were there. And we had the right people, we had the right heart, the immediate response from the nurse to see the child, and then being able to, deliver the wonderful result and make sure that the child survived.
For those that are listening that are currently Advent Health employees, what's the first step that they can take right now if they listen to this podcast and they're motivated to support the efforts of your team? What's the first step that they can take to get involved?
So one, we want to know your interest. And so we actually maintain an email database that people that are interested in learning more about global missions, if you want to be added to our database, we send out regular communications, upcoming trips, different things. And so the easiest way to do that is to go to our website. So it's real easy, adventhealth.com/global missions. That'll get you to our website. There's a contact us button that you can put in your contact details and you'll be on our email list. Then the website itself describes our footprints, has lists of our upcoming trips. So all of that's involved. It also has a donate now button kind of thing. So if you are interested in supporting our work, you can do that. Also, the Generosity Champions program, employee giving, you can designate global missions as a beneficiary. And so the money that you give is used to offset the cost of medications that we use during our mission trips and also other programs, projects that we're working on with our footprints. And so really can make a lot of difference.
Okay, so just so I understand, and also the listeners, they probably have the same question. You mentioned a donate now button, and so you can just give, but then you can also give in a different way that allows you to offset costs such as the Medicaid. So there's two different.
Right.
Okay, so where does when you give to one, it just goes directly to the global missions team.
So you can designate for sort of greatest need, which is sort of undesignated for whatever global missions wants to designate it for, or we allow you to even designate by country. So if you have a family background, say from Haiti, you could donate money to benefit the work that we do with Haiti Adventist Hospital in the suburbs of Port-au-Prince. If you're from Jamaica, you can donate to our work in Jamaica, and Andrews Memorial Hospital in Kingston is where we work. So each of the countries that we work in, you can donate to a fund to benefit that country or that institution that we work with. Separately, though, through employee giving, you can do payroll deduction. And so that can be a recurring gift that you do through your payroll. And that goes, like I said, to things like medication for our mission trips, and then other projects that we identify throughout the year that we say, hey, they really need this anesthesia machine. We're going to use money that our employees raised to fund this anesthesia machine. Our volunteers will use this on the next surgical trip, things of that nature.
Amazing. I think that is making it easy, right?
Yep.
Especially when you talk about the whole care and the whole person, right? Understanding that if you're an employee at Advent Health, not only can you help, but you can help in a very specific way that almost may even reflect your heritage, your culture, right? Where you're from. So that's unique. I
Yep.
really love that. Really love that. I know that you have about 8 people, like you mentioned, on your team. I wanted to speak very briefly about operations because I have to imagine that that is a very robust department for you, especially because you're talking to people who are in different time zones, right? So, what are some of the challenges that you all face operationally when trying to, have these different projects go through?
So, as you mentioned, time zone issues. So, if you're working in the Philippines, it's 12 to 13-hour time difference just based on the time zones alone. And so, we'll be doing meetings at 7 in the morning or 7 at night because there'll be the opposite time zones for that. And so, those types of things come into play. And then, language is always a challenge too. So, I'm blessed to have multiple people in my team who speak Spanish. Unfortunately, mi habla español malo, or, I don't speak good Spanish at all. And so having people who can help with translation is key. But there's other countries where we don't necessarily always have those language skills. And so, part of that assessment is, do they have the language skills to be able to interact with us in English? So from that operational standpoint. The other challenge that I find is that every country is sovereign nation, right? They do things their way. And so we think, oh, well, hey, in the United States, customs does things this way or immigration does things that way. It doesn't mean that that country that we're working in does things the same way. And so you think, oh, we're a nonprofit organization. We can just donate that to you. Well, some countries are like, yeah, we're still charging you duty on that to bring that into the country. And so those types of operational challenges, really, it's a matter of each country is unique in the work that we do with them. You have a learning curve for everything.
Yeah. Yeah. And I think that's for me, I don't know what your biggest takeaway from this is, Scott, but for me, understanding how much you guys listen before you all do anything. And I think that's something I didn't think about because as a human, right, I think we just think, well, if I'm gonna help you, you just take what I can give you and you should be grateful. But I just love that we first listen and understand their culture as you were just explaining. And I think that's for me, as a human, I think that's a step sometimes we just don't think about. So yeah.
Yeah. No, I know for us, we have a phrase that we don't want to send junk for Jesus. And so
I love it.
from our warehouse standpoint, we want to send things that people need and want. And so there's a tendency to say, oh, they'll figure it out. Let's just send it to them. And it's like, well, if it didn't work here, why did we think it would work there? And, if they have challenges getting the right maintenance, biomedical engineering support, if it doesn't work here, it's not going to work there, and they're not going to be able to fix it, and then you're going to just add to somebody's landfill. Well, that doesn't need to happen, right? We want to be responsible around that. And so making sure that what we send out is useful is a key part of it. And I guess that's another area of involvement here locally, is that usually every other Friday we have a volunteer event at our warehouse where volunteers can come in, typically for 3 hours or so, help us sort medical supplies. We have a couple hundred people usually a year that are helping us do that. Because last year, for example, we sent out shipments to over 25 different countries of medical supplies, 50 some shipments that we sent out, about 14 container loads, 40-foot containers of materials. And so there's a lot of things that come through our warehouse that are donated from throughout Advent Health to us. And that volunteer help of sorting them out by expiration date, making sure that it's not expired, is really very helpful for us.
Well, Monty, thank you so much for being here today. We are so inspired by the work that you all are doing, and we hope that our team members are inspired as well to be able to join and support, whether that's through time, prayers, donation, whatever our team members feel inspired to do. And for those listening outside of the organization, hopefully, if this is an area that you're interested in, you find a way to get involved however you can. But thank you to our listeners for listening to the Whole Career Podcast. We hope that you subscribe and listen on your favorite platform and follow us at Life at Advent Health so you can send us suggestions on what you'd like to hear from us next. But until next time, take care.